Perfect. Good morning, good afternoon, good evening, everybody who's signed on to today's seminar, Disaster Risk Finance for Better Response to COVID-19 and Other Risks. Disaster Risk Finance for Better Response to COVID-19 and Other Risks. This will be the 26th webinar of the Social Protection Responses to COVID-19 webinar series. And this series is a joint effort initiated by the IPCIG, GIZ, on behalf of the German Ministry for Economic Cooperation and Development, BMZ, and the Australia government's Department of Foreign Affairs and Trade, DFAT, in collaboration with the socialprotection.org platform and in cooperation with partners from different organizations. This webinar series is part of an initiative with two other major components: a collaborative mapping of country news and documents disseminated weekly through a dedicated newsletter, and an online community on the topic to systemize information and foster discussion. You can join the online community Social Protection Responses to COVID-19 Task Force to learn more about the whole initiative, and you can find out how to collaborate and keep updated about future webinars. Speaking of future webinars, the next one will be on VSP responses on August 18, and it'll focus on social protection and violence against women and girls in the Indo-Pacific region responding to COVID-19. You can already register to this. Links will be posted on the chat box. We are very happy today to have a distinguished set of panelists who gladly agreed to join this seminar. Hope this works. The first speaker today will be Dr. Olivier Mahoul. He is practice manager of the World Bank's Crisis and Disaster Risk Finance Unit, where he oversees the Disaster Risk Financing and Insurance Program, the World Bank UK Disaster Risk Finance Hub in London, and the Global Risk Financing Facility. He's one of the world's leaders in the field and has been so for many, many years. I think most people who work in this field have at some point met or worked with him, and we are glad he agreed to be part of today's seminar. The second person who will be moderating alongside me today is Ms. Evie Calcutt. She's a financial sector specialist in Olivier Mahoul's team. Just to the organizers, I'm having a bit of a problem to go from one side to the next. Okay, there she is. She's a qualified actuary with experience of insurance and investment projects and joined the World Bank a few years ago. She is part of Olivier Mahoul's team. The next speaker is myself. I also work on Dr. Olivier Mahoul's team. The next speaker afterwards will be Emma Mistian. She's a senior social protection specialist with the World Bank and has been very much working on social protection in Africa. She will share her experience on shock responsive social safety nets today and give a couple of examples. She will be followed by Lindsay Paul-Jones, who is a senior risk monitoring and analytics specialist at the World Bank's Global Crisis Risk Platform. And last but not least, we will hear from Sophie Evans, London-based, who works for the Center for Disaster Protection. She's previously worked in capacities for the insurance sector. We would like to clarify that at the end of this session, there will be a Q&A session. So we would encourage you to send questions to us, the panelists, throughout the webinar. We will make our very best to address all the questions during the last Q&A session at the end. If not feasible, if you run out of time, we will prepare a Q&A written document to be shared with you and to be published with the webinar summary. So let's get right to it. This is today's agenda. We want to cover a lot of ground. We will start with Olivier Maroul, who will speak about strengthening financial resilience. Then Evie and myself to talk about disaster risk finance for shock responsive social protection. Emma will give a couple of examples of shock responsive social protection in Kenya and Senegal. Lindsay will talk more specifically about risk monitoring, how to better support preparedness. And Sophie will talk about how to track, about her work on tracking funding flows to understand basically how money reaches the beneficiaries. The main questions we like to tackle is, how does the crisis and disaster risk finance agenda link to the social protection agenda? What impact does COVID-19 have on the DRF agenda? Implications of compounding risks and DRF strategies? In which ways can we support countries to plan better and financially respond to shocks, including health shocks like COVID-19? What lessons have we learned to date from disaster risk finance for social protection? And how could this inform mechanisms for COVID-19 response? How can we assess the readiness of SP systems for the next crisis? How does the World Bank identify, anticipate, and monitor potential compound risks in severe complex crises? And lastly, how can we ensure that money actually reaches those who need it the most? I would now hand over to Dr. Olivier Maroul.
Thank you, Simon, and good morning, good afternoon to everybody. I'm really delighted to be part of this event. One of the reasons is that when we started exploring this topic or the interface between disaster risk finance and social protection about 6-7 years ago with colleagues like Barry Maher, this was something which was quite new. So I'm very pleased to see that things have evolved and in fact are getting even more relevant in the context of COVID-19. So on that slide, let me just highlight, as you can see, the impact of disasters on public finances and poverty reduction and of course trade balance. Although the topic today will be more on the impact on social protection, so the social impact is also very much related to the broader economic and financial impact. And most of you may be aware of the overall economic impact of disasters. Every year, on average, about $300 million losses are caused by disasters. And if you try to include I would say the consumption losses or the welfare losses, it goes up to $520 billion. Most interestingly, in the context of this seminar, it's interesting to notice that disasters, on average, every year, push about 26 million people into poverty. So this is definitely a strong social impact on the top of the economic and financial impact. And of course, those average numbers do hide a large diversity, as you can see here, whether you talk about countries in Africa, like Lesotho, Kenya, countries in South Asia, like Bangladesh, or of course, small island states like in Fiji and Vanuatu. But overall, of course, this impact is getting even stronger with climate change. And as I will briefly mention later, and of course, other speakers will elaborate on that one, the impact of COVID-19 will be on top of that even more significant. So on the next slide, let me give you a quick, I would say, overview on how we think about disaster risk finance. Previous slide, please. This graph is from a technical note we were asked to prepare for the G20 chair at that time, Japan, in 2019. And it's part of the broader resilience agenda. And it was a way to some extent to, I would say, structure the discussion about what we call financial resilience. And this is where, to some extent, from the financial sector, we're having a kind of leading role, particularly dealing with the Minister of Finance. And it's all about pre-arranged financing. And again, we will elaborate that today in the context of social protection, but also to clearly identify and articulate the link with what we call physical resilience, how to reduce and prevent the disasters when it comes, for example, to quality infrastructure, and also in the context of this seminar, linking that with the social resilience on how to help households, and particularly vulnerable households and societies dealing with those shocks. So although we focus in my team on the financial resilience agenda, of course, this is clearly related to the physical resilience and the social resilience. And I would say resilient country, a resilient economy, a resilient society will have to combine the three types of resilience in order to make it fully resilient to shocks, not only disasters, but also, as you can see now, to pandemics, for example. So on the next slide, this is a way we tried from our side to articulate the work we're doing. And what is interesting here is really to highlight how we do see what we call disaster risk finance supporting other topics. Fundamentally, what we're trying to do here is to, I would say, improve shock responsive systems and to make them more financially prepared. And this can be applied to a wide variety of sectors, including, of course, social protection when it comes to protect vulnerable and poor households, but also the same kind of principles, techniques, if you wish, coming from the financial sector and particularly the insurance sector is relevant when we talk about shock responsive infrastructure or other types of sectors. But so fundamentally, this is really to try to develop a set of analytical and advisory services, financial services to help our clients increase their resilience on, as I said, different fronts, different sectors. And of course, in that case, when it comes to social protection, the link with adaptive social protection, shock responsive social protection is quite important. So this is one of the element, if you wish, of the entire picture. But this kind of program financing, to some extent, will also allow for more timely, more efficient, more cost-effective actions to be taken once the financing is in place. Now, on the next slide, and this will be my last slide. Of course, things have dramatically changed in the context of COVID-19, and just to give you an example, or at least to illustrate that, as you may have heard from different sources, including the June 2020 edition of the World Bank's Global Economic Prospects, the impact of the crisis, the forecast is about a 5.2% contraction in global GDP. What is even more, I would say, concerning or worrisome is that this will come on top of disasters. And for example, while the overall world, in fact, and the overall economy was trying to battle with the COVID-19 pandemic in April, for example, small island states at the same time were hit by tropical cyclones. Likewise, in Africa, locust is also having an impact on pasture in many countries, including Ethiopia, Kenya, and Uganda. So this adds one additional layer of complexity, one additional dimension, if you wish, to the overall shock responsive agenda and resilience agenda, which is this kind of compounding impact of shocks, combining pandemics in the case of COVID-19 and disasters. My colleagues later on will talk about that, but this is definitely the next, I would say, challenge countries are facing, where they're going to have, and they're already having to manage, I would say, at the same time, the pandemic and, of course, the potential impact of disaster. So what are the potential solutions, including financial solutions, that could be designed in order to help them, deal with those correlations among potential disasters going beyond natural disasters. So again, if I were to conclude before I pass the floor back to Simon and Evie, I would say that financing is quite important. This is one piece of the broader agenda, but unless you are financially prepared, it's very difficult to act, I would say, quickly and timely when a disaster strikes. So this is to some extent the all-in-your-hand gene, and this is why, in fact, it's important to think of not only public financial solutions, and this is where the World Bank can play a role, but also blending that with some private market-based solutions, since I would say the overall economy and the public sector, including in our client countries, won't be able to absorb those risks in their public balance sheets. So important also to highlight the role of the private sector, not only in providing technical expertise, and tools, but also in providing ultimately some financial capacity through innovative solutions that could go up to very innovative solutions related to pandemics, and some countries are already talking about that. So I'll stop here. I very much look forward to to hearing from the other speakers. Again, it's a very important agenda for the World Bank, and particularly for our finance team in the bank. Thank you very much again for joining, and let me now hand over to Simon and Evie for the rest of this presentation. Thank you very much.
Thank you very much, Olivier. Evie and myself, we will now talk about disaster risk finance for shock responsive social protection. And we will, first of all, remind people quickly of what disaster risk finance is. So basically, it's all about ensuring that money reaches people who need it the most, when they need it the most, helping governments and individuals, companies, etc., on meeting the cost of disasters before they happen. And when they happen, then increasing the speed, predictability, and transparency of a response to disasters. Disaster risk finance is based on a couple of principles. We name 4. First of all, being the timeliness of funding, meaning that speed, of course, matters. You want to get money and support to people when they need it, but not all resources obviously are needed at the same time. So disaster risk financing has to ensure that the government requires the funds when they need it. First of all, during relief, then recovery, and the biggest chunk during reconstruction phase. The second principle is how money reaches the beneficiaries. So being unable to spend money and quickly in the aftermath of disasters makes obviously a response really difficult. So we support countries build the right mechanisms, experience, and expertise to allocate, disperse, and finally also monitor their recovery and reconstruction efforts. Thirdly, there's the disaster risk layering. So what we mean by that is that basically countries need the right mix of instruments. Like when you eat, you need a balanced diet, and you need a set of instruments, because no financial instrument can address all the risks at once. So governments ideally should combine different instruments against different frequency, severity of shocks. This is what we call risk layering. So it means that the cheapest sources of money are used first, and then the most expensive sources used only in very exceptional and very intense circumstances. And the last one being a principle being data and analytics. So obviously, government decisions need to be based on the right information and data. And our team has a whole analytics team who advises countries on this kind of on these things. So ultimately, there are 3 pillars for success, as we call it. So the first one is a coordinated plan, basically ensuring that there's one credible disaster plan that defines very, very clearly the responsibilities and also liabilities of all stakeholders, which means who will have to pay for what will be protected against what, how is the decision-making process in the aftermath of a disaster, and clarifying who takes on which risks. So government, national, regional, local, what risks will be shared with households, with international partners, the international financial markets, etc. Secondly, the decision-making process, who identifies transparent rules to guide the decision-making, based on data and analytics, obviously, but also defining roles and triggers that result in pre-agreed interventions. And thirdly, the pre-planned financing ensure that the plans can actually be implemented, meaning that funds are available and only if they're required by a plan. So you don't over disperse basically resources that you don't need. And lastly, binding partners to pre-agreed objectives, decision processes, modalities of how to implement, etc. So basically, we see that there are multiple benefits, more than those four that are listed there, to pre-arranged financing. Basically, studies have shown that $1 in pre-arranged financing can save up to $4 or $5 even as compared to searching for money after disaster occurs. And as we see here, in a late humanitarian response, it can even save up to 7 times. It allows households to mitigate coping measures, so they don't have to sell their livestock, take kids out of school, etc., etc. And governments themselves, they don't need to divert to coping strategies either, like budget restructuring, diverting funds from other needed public services, etc. And I now hand over to Evie.
Thanks, Simon. Hello, everybody. Good day. I'm just trying to move this slide forward. Give me one sec. Simon, I think you're in control. If you could move the slide, that would be great. But just to, so I'm going to talk a little bit about why DRF. Thanks, Simon. Why DRF is so important for this kind of strengthening social protection systems. And Olivier alluded to this point at the start, where he said there's a kind of a new dimension to the shock responsive agenda, and in part that comes from the fact that we, within our team, the Crisis and Disaster Risk Finance team, a lot of our work has been showing the strength in DRF to specific disaster shocks, predominantly climatic shocks over the last decade, and building financial preparedness to support kind of the response to that. And actually now, we know that multiple shocks can happen at the same time. We don't know a lot about what that means and what the impacts of multiple shocks happening at the same time, the interaction, and COVID-19 has really highlighted that, and the need for us to explore that more, but actually also embed more financial preparedness and potentially new instruments and more flexible instruments to be able to respond to a number of risks rather than just a very specific risk. But these aren't mutually exclusive, and you need different instruments for different types of response, as Simon said, with the point around timeliness and risk layering. So just quickly on this point around compound risk, because it's a term that we're using quite a lot, and I know Lindsay's going to say a lot on it. So effectively, we're talking about when two or more risks interact here. And within our team, like I said, we focus on supporting countries to prepare better for, say, droughts or flooding events, which are seasonal and can be expected over time with a certain degree of likelihood. And then when you interact those with this health shock, which we don't know much about yet, we know a lot more than we did 6 months ago, but in terms of the financial implications, we know they're going to be significant, going to be huge economic and financial implications, as well as the health shock. But we're still learning, and we need to use what we know now to prepare for the future. And the picture here is just a really simple kind of illustration of the types of monitoring we're thinking about doing, and we're going to talk about what this means for SP systems. This is a picture of a potential path of the COVID cases in Ethiopia, Kenya, and Somalia. So that's the light blue line. And we've seen that those cases have started to sharply rise, especially in Ethiopia and Kenya over the last 6 or so weeks. And potentially they're going to peak, although there's a lot of uncertainty around this curve. So please take this with a pinch of salt, especially against the timings at the bottom. But what we can do is think about, well, how might this health shock interact with other seasonal risks that the country face, whether it's drought risk or flood risk, and start to think about, well, how do we better prepare? in particular, some of these countries have prepared for these types of shocks, but actually some of their instruments have had to be reassigned to manage the health shock or the economic crisis or the financial crisis that they're facing, and therefore, that leaves them a couple of steps back from where they were with their strategic thinking about responding to the seasonal shock. So we're working with a number of countries to think about that, and social protection has really been a channel for responding quickly, and it's been proven, it's been shown in the last few months how quickly those systems have been leveraged to get funding out to the people who need it most. So I'll talk a little bit about there we go. This slide is fine, thanks, Simon. So what do we mean by shock response to social protection in terms of DRF? So we're talking about responding to shocks using regular systems and scaling them up, and this can be in multiple ways. So it can be vertically, where you still reaching this kind of regular individuals who may be under regular safety net programs, or providing additional funding to new people or new households, or could be firms, but let's think about this in the social protection sense. And for example, we've seen with COVID that actually that horizontal expansion is proving quite important, because new groups of households are needed to be supported, potentially those in urban areas compared to rural areas, which may be the kind of focus of regular programs. And there are challenges in scaling up these programs in a way that's transparent and efficient, and we think that a disaster risk financing approach can support a better system. And the reason for that is that it's evident that shock response to social protection is an efficient way to scale up during a crisis. However, sometimes it can take time to get funding out through the systems. You may need to do assessments, vulnerability assessments, funding appeals, and then certain decisions have to be made. And that can be slow, and as Simon said, can have impacts on welfare, which can be long term. With a DRF approach, you can set up some financing strategies in place to make sure there's a trigger for response quickly, and that can be following a shock or even before the big impact of a shock, say drought, happens, to try and reduce some of those negative impacts. Now, this doesn't necessarily mean you're going to have all the finance you need straight away, but it can mean you have a small amount of finance to support the most needy, and then build on that over time as needed. Sorry, the slides didn't move on, but so these 6 steps are how we think about DRF for shock responsive social protection. So just very quickly, number 1, developing a risk profile. So understanding your risk, and that's key to thinking about who you want to protect and how much it's going to cost. The second one is having discussions with the key decision makers around deciding on policy priorities. There's only so much funding available, and therefore you need to think about prioritize those, which can help you with step 3, which is designing the mechanism. And I know Emma's going to talk a bit about her experiences, because she's been a kind of a lead on a number of these designs. Then once you've designed a mechanism, there's kind of feedback loops, and you can think about, well, how much does this cost? So if you want to design a mechanism to respond to say a very fixed trigger on drought, then you can think about, well, let's cost this, and think about how much money do we need to put aside, and what's the right instruments to use to respond to that. And that's what step 5 is, so devising a DRF strategy and using risk layering. And then the final step is monitoring that and feeding that back. And Emma's going to talk about this from her experiences in Kenya, where I've also been lucky to be involved. So, like I said, over the last decade or so, the team, and led by Olivier, have been applying this DRF approach through shock responsive social protection. And the key lessons that we've learned are that you need to understand the cost of responding. So in order to make sure you get finance out quickly, you need to be able to cost it. The second one is to have those funding and financial instruments kind of pre-positioned. Again, not all the funding will be available, but having quick finance that's liquid and ready to go through the systems is definitely an added value. And the third one is having those disbursement systems in place. So it's, you can't have one of these. They're all really important parts of the puzzle, and understanding the having the finance is only valuable if you can get the money out. So we've been reflecting within our team on what this means for the current crisis as well as new ones, because although it can be kind of easy to take a step back and focus on the COVID response and deprioritize maybe financial preparedness for future risks, actually what the crisis has highlighted is the need for better preparedness now for those risks, and those who did prepare have fared so much better. So from my own experience, I've seen that the countries where they were already talking about shock responsive social protection and they were already having those discussions were much more equipped to get money out the door, and to think about how they channel those funds and how they leverage the systems that they already have, whether it's the registries or the payment systems. And so the social protection system really, the social protection sector provides an important lesson for us all here, and having an efficient strategy for managing those risks is well thought through. So what we've learned from COVID is, against these three lessons, we know the current crisis isn't going anywhere. So we know that sadly, lots of countries haven't kind of seen the peak of this shock. So can we use the data and analytics to understand the risk better, and think about those interactions? Second of all, we know that a lot of funding has been redeployed to manage this COVID risk. And can we, so now's the time to take stock and think, well, where are the resources? Have they all been drained? How is a country going to be able to respond if there is a serious drought, for example, in the coming year? The other key thing around planning financing is thinking about those triggers. And I'm sure Emma will say a little bit about this, but in order to have a robust system, you can't just have one trigger, because that leads to something we call basis risk, potentially. So are there better ways that we can build robust systems around multiple triggers? So having an early warning, a very simple, maybe using satellite or remote sense data to tell us what are the conditions on the ground. Okay, it looks like there's a drought, or it looks like there's been this area's been hit by a flood or a storm, but then having other mechanisms and data sources to inform and follow that up and use as a fail-safe approach. And then thirdly, again, we've seen that the effective disbursement systems already in place mean that actually responses have started in countries where they already have shock responsive systems in place, whether it's using digital technologies, mobile phone coverage, e-banking, those types of things. So I'm now going to pass over to Emma, who's going to give us the more kind of on the ground field experience in Kenya and Senegal.
Thank you, Evie. Thank you for handing over to me. I'm very pleased to be here today and to take part of this interesting webinar. As Simon earlier mentioned, I'm part of the Social Protection and Jobs team at the World Bank, and I've been working very closely with the DRFI team in Kenya, and I'm currently part of a regional programmatic task that supports 6 countries in the Sahel related to shock responsive social protection. And one of the key pillars under that work is disaster risk finance, where we work very closely with the DRFI team. Today I'm going to talk a bit about the case of Senegal and Kenya and highlight some of the key lessons learned so far. And I should also say that I have been more actively involved in the Kenya experience and less so in the Senegal one. Let me see if I can change the slide. So in Kenya, there is an existing single registry of beneficiaries, where around 1.3 million households are registered and benefiting from the National Safety Net Program. As part of that registry, there is a mini social registry that basically serves the Hunger Safety Net Program. And the Hunger Safety Net Program is an existing shock responsive program. It provides regular cash transfers to around 100,000 beneficiaries in 4 of the most drought-affected counties in Kenya. But it also includes a scalability mechanism that has the ability to expand to support additional households, a maximum of an additional 270,000 households based on the triggers. In Senegal, there is a social registry that includes around 560,000 households, and 300,000 of those households are part of the National Safety Net Program and receive regular cash transfers. There is currently no existing shock responsive program in Senegal, but the government has piloted shock responsive interventions to respond to food insecurity, floods and fires, and there are ongoing discussions around a potential future shock responsive program. So what are some of the key pillars for a shock responsive social protection system? Ensuring government leadership and ownership is important for any program, but is particularly important for shock responsive social protection. Similarly, defining institutional arrangements and clear roles and responsibilities, both within the government, but also with external partners, is really important. Timely and accurate information is also necessary to inform the shock response, and having programs and systems in place ahead of time to enable quick response is also very important. And lastly, the pillar around finance, ensuring pre-planned financing for speedy response is critical. And collaboration between the social protection and jobs team and the DRFI team is particularly important for pillar 3 and 4, focusing on using data to inform the shock response, and obviously pillar 5 to ensure reliable and sustainable financing. So in Kenya, the social protection and jobs team has been working closely with the government and the DRFI team in a number of aspects to build government's capacity and understanding of disaster risk financing and its important role for shock responsive social protection. We've been closely discussing and dialoguing with the governments in these 2 countries. Analysis was undertaken also in both countries using historical data to better understand the risk profile and to estimate the cost of potential scalability. In Senegal, the teams are initiating dialogue around a disaster risk finance strategy. And in the case of Kenya, the government has already adopted a disaster risk finance strategy, which includes shock responsive social protection. And the government has also prepared a specific financing plan specifically for the Hunger Safety Net Program with support from the DRFI team. So what are some of the key lessons learned that I thought would be useful to highlight in this forum? The first one is that investing in delivery systems upfront to enable a swift and efficient response is really important. So having a social registry in place consisting of data from existing beneficiaries, but also potential beneficiaries is really important, but also to ensure the quality of that data and regular updating that data. And to make sure that stakeholders have confidence in the system and are willing to use the system. As mentioned, in Senegal, there's an existing social registry, and the government is in the process of updating the information in that system. And in Kenya, there is a mini social registry, but the government is in the process of expanding that nationwide. Another critical thing as part of the systems is the processes and procedures. So there are, under the Hunger Safety Net program, there are two groups of beneficiaries. The group 1 supports the poorest households with regular cash transfers, and then group 2 consists of households that are eligible for emergency payments depending on the triggering mechanism. And then there is in Kenya an existing electronic payment system. All HSNP households have been pre-registered and have bank accounts, and this has really enabled immediate payments of emergency cash transfers as a response to drought in the past under the Hunger Safety Net program. A second important lesson to highlight is that having a shock responsive program in place is really critical and enables swift response. So in the case of Kenya, the Hunger Safety Net program has a pre-existing methodology, processes and procedures, clear implementing arrangements already in place, which has enabled timely response to drought. And in the case of Senegal, the lack of such an existing shock responsive program limits the use of the safety net system for any type of shock, but most recently in the COVID response, the government didn't use the regular safety net program as a part of the COVID response, but they did use the social registry as part of the targeting of the food distribution. That was part of the COVID response. Two more lessons that I want to highlight before I finish. The next one is that objective and automatic triggers is really critical for speedy response. Evie mentioned this as well in her presentation. As mentioned earlier, it's really important to be able to respond very quickly to support households that have been negatively affected by shock, and having a triggering mechanism in place that is automatic and objective is really critical to be able to move quickly, but also to enable a transparent approach. So in the case of Kenya, the system currently uses a VCI index that uses satellite data and triggers emergency payments. And there are clear processes and procedures in place for when and where emergency payments are triggered. But it's also important, and Evie alluded to this as well, to have a regular review and update of any triggering mechanism to make sure that it remains valid, and but also to ensure that stakeholders have confidence in the triggering mechanism. And in the case of Kenya, the program, the HSNP program, has been relying on a single indicator as a trigger, but there is currently an ongoing review of the triggering mechanism. Lastly, my final point and important lesson learned is that having a disaster risk finance strategy in place can really help ensure adequate and timely funding. Kenya has successfully financed shock responsive cash transfers under the Hunger Safety Net program. But it's worth to highlight that this program only covers 4 of the most drought-affected counties, and there are a total of 47 counties in the country. So it's only in a certain geographic area that the program operates. The government has plans to expand further into a total of 8 counties. But I should also mention that I mentioned earlier that the government has a financing plan in place for the Hunger Safety Net program specifically, but it's also at quite early stages in terms of full government implementation. And there is, although the government has successfully financed the shock responsive cash transfers, there is an incentive mechanism currently in place, which is structured around what we call disbursement linked indicators as part of a program that is co-financed by the World Bank and DFID. And this basically means that when government submits evidence that they have made the emergency payments as triggered by the program in a timely manner, the government and the World Bank and DFID disperses money to the government. And then lastly, in Senegal, as I had already mentioned, the team is currently holding discussions with the government around the potential preparation of a disaster risk finance strategy, which would include financing for shock responsive social protection. So let me stop there and hand over to Lindsay Jones, who will be talking about risk monitoring to support better preparedness. Thank you.
Thank you, Emma, and I hope you can hear me. Hi, so my name is Lindsay Jones, and I am, as Simon mentioned, I'm a member of the Global Crisis Risk Platform, which is a program within the bank that looks at a number of aspects to do with risk monitoring and disaster risk monitoring. And one of the things that we have been particularly interested in thinking about over the last sort of 6 months or so has been the issue of compound risk. Obviously, everyone around the world at the moment is really experiencing one particular risk, and that's the epidemic through COVID. I'm just going to see if I can make these slides move. There we go. So the interest in compound risk has really skyrocketed over the last few months. Evie mentioned a little bit about what compound risk is. Essentially, it's the interaction of different risks. Now, that can be either in relation to kind of the spatial interactions, so where they occur. That can be in relation to the temporal interaction, so that could be one disaster affected shortly after by another one, or it could be in relation to different types of hazards kind of working together to either increase or decrease risks that are felt on the ground. And we've seen this really kind of hit the headlines, both in the academic world and in the kind of the policy world. So, we had Cyclone Harold hit the Pacific, which Olivier mentioned earlier. We also have the ongoing locust outbreak, which is affecting much of the Horn of Africa. And in each of these cases, we have very complex dynamics with one particular hazard interacting with COVID, with quarantines, with different kind of dynamics on the ground that mean that risks are really amplified, and it's difficult to coordinate risk reduction activities in a single manner. So what we are particularly interested in at the moment is thinking about how do we track compound risk. Now, it's difficult we kind of recognize that it's difficult to track a single risk. So if we're interested in kind of climate risks, or if we're interested in issues to do with things like conflict, that in itself has many limitations and very many uncertainties. When we expand this to think about kind of how they interact and they compound, that gets very challenging. But that doesn't mean that we shouldn't be attempting to look at least at higher levels as to what's going on around the world, what's going on in particular regions, and try to think, if it's possible at all, to try and monitor those in near real time, and potentially looking into the future as well to look at emerging risks and where the kind of the hotspots might be for particular interactions of risks that we know compound very acutely. So that's sort of the work that we are doing through GCRP. It's this kind of initial prototyping to start thinking about how do we start tracking issues of compound risks that can be useful and informative to decision makers. And in particular, decision makers that are working in the humanitarian and development space. Social protection is, a key part of that, and one where there's a lot of uses in thinking about real-time monitoring, information, informatics that can inform how we design and target social protection systems. Some of the things that Emma mentioned, particularly around triggers, and how we decide on when to trigger particular disaster risk financing mechanisms really hinge on important kind of clarifications for information, for understanding of what's going on the ground, and near real-time updates on how issues of vulnerability are developing as these kind of crises interact and compound at local levels. So what we're trying to do is to develop a system that draws on pre-existing risk indices and metrics wherever we can. There are hundreds of different risk indicators. I'm sure many of you will be familiar with them. One in particular, the Inform Risk Index, which the EU manages, is a well-known one and is used quite widely within the development and humanitarian systems. What we are trying to do is kind of augment that and build on what is existing and see whether we can update it through use of better real-time information as well as forecasted elements, rather than just looking at historical perspective to sort of see which countries are most at risk and prone to issues of compound risk. The objective here, just to mention as well, is not, we're never going to be in a position where we can, robustly and 100% guarantee that all information around compound risk is going to be accurate in a tracking system. All we want to do is get to a stage, or at least pilot something, where we can sort of see whether this information is good enough to inform decision-making, potentially at a higher level. So we're not looking down a very, very local level because we don't have that data, but scaling it up to kind of country and regional levels to give us a good enough, basis to inform decision makers about what's happening on the ground, what sorts of risks are in the process of compounding, and what we might be needing to pay attention to in the months and the weeks ahead as part of those planning procedures. So let me kind of unpick a bit of that black box a bit about how we're doing it. Unfortunately, I don't have the kind of the depth and time to go into all of the methodological details for some of our prototypes, but I can give you a kind of a sense of a flavor of the recipe that we're using. So essentially what we're starting to do is to break risk down into different components. Especially with compound risk, you have to recognize that we're looking at different sectoral issues. So we have broken it down in our kind of methods at the moment into 8 different risk components. So it ranges everywhere from your natural hazards to do with climate, earthquakes, volcanoes, and all of those, through to kind of food security, and then your kind of COVID-specific vulnerabilities, whether that's applied at the household level, so household vulnerabilities, as well as the macroeconomic vulnerabilities that we see at the kind of the higher societal levels. So we break those down into 8. What we then do is try and assign as many appropriate indicators that we can into those specific 8 core categories. Those indicators are aggregated, and then we assign particular thresholds. So we have thresholds for all 8 of those components for each individual country. And we use expert solicitation wherever possible to assign those thresholds, as well as some common sense and a bit of guesswork for some of the ones where it's developing, like in the COVID context. So we have particular thresholds that we're assigning. They are, to the extent they can be, relatively objective, with some subjectivities, obviously, with some of the newer ones. And what we try and do in each of those cases for all 8 is look at 2 things. So we kind of group them into 2 categories. One is indicators and kind of tracking procedures that help us understand the existing levels of risk in relation to each of those 8. So that's basically looking at the likelihood that a country is predisposed to be hit by issues of compound risk. And the more important one for us at the moment, the real kind of value add we see in some of these systems is to think about the emerging risk, right? So we're looking at indicators and kind of tools that allow us to either reflect on what's happening in real time, so looking at changing risk conditions that are happening on the ground right now, as well as forecasted ones. So in most of these kind of core components, we have good, reliable indicators that can give us an idea about the next 3 to 6 months in the future. Where are we going to likely see some changing risk conditions that we need to be thinking about and aware of? For example, for natural hazards, we have pretty good ideas around certain seasonal forecasts, whether that's to do with hurricanes, cyclones, or things like the El Nino cycles. For food security as well, there are organizations and initiatives like FuseNet, which we can draw on relatively reliable sources of information that have a good historical precedent to help us understand, changing risk conditions either on the ground right now or into the future. And like I said, the real value add we see in systems like these is being able to include real-time updates, including the expansion of policies. So as part of the metrics and the systems we're using, we're trying to factor in things like the rapid expansion of social protection systems and mechanisms that we've been seeing around the world in relation to COVID. So, these are each things that we can plug in and try and get a better understanding of how vulnerability is emerging on the ground. I won't go into too much detail in terms of the outputs. This is very much a prototype, but I'll give you a bit of a snapshot of some of the things that that we find when we look at this kind of a methodology and we put it all together. So this is in relation to the the outputs that we get for the historical risk, or the likelihood. Here is what we're seeing is the likelihood of a country to be hit by multiple different risk components based on historical trends. So you'll see many of these kinds of kind of risk indices that are already out there. In this case, we see things like Somalia coming up very acutely. We also have big parts of Central Africa through DRC, through South Sudan and Central African Republic that are highlighted as areas where traditionally, historically, we see multiple risk components hitting at the same time that we should try and be aware of. The bit that we're probably more interested in is thinking about the real-time elements. So this is, an early, again, lots of caveats, but an early kind of idea of some of the risks that we're seeing emerging on the ground right now, or likely to be in the near future. And what you can see is that there are, quite a bit of correlation in terms of the areas and the countries, but not exact. So, for example, one of the highest ranked countries so far in relation to our monitoring systems comes up as Mozambique. We also have areas like Sudan, North Africa as well is highlighted very acutely as an area that is likely to be hit by or is currently undergoing issues of compounding risk. We also have big parts of Latin America. And what we can also usually try and do when we're communicating and understanding this is sort of think about the more kind of narrative views as to why we're getting some of this information. So it's not just a quantitative perspective, but also, kind of combining that with the qualitative side too. So, thinking through why Mozambique might be coming up quite highly. Well, we have ongoing conditions of drought that's been going on for a while, and it's likely to continue, or at least it's forecasted to. We have worsening food insecurity conditions. We have a very, it's very difficult for many Southern African countries at the moment to respond to the COVID pandemic with rising cases and infections. And in places like Mozambique, certain regions are experiencing heightened conflict. So that's the kind of a breakdown as to the sort of things that we'd be picking up on in some of these tracking mechanisms. Then you have wider things as well. So for example, Latin America, there's been widely advertised around a high infection rate, particularly in places like Brazil, Ecuador, Peru. But in particular, places like the Caribbean, LAC, and many others, we have large expectations for big hits on the economy and growth. So these are things that we're trying to factor in and think about, how do these different sorts of risk, these components interact, and where might these regions be or these countries be where we might want to flag particular issues? Again, not as a ranking exercise, but just to be aware of how different risk conditions and risk components are emerging as we go forward. Okay, so like I said, I don't really want to concentrate too much on the on the maps and the outputs for now. It is very much a prototype, but that's the kind of thing that we're hoping that this can give a flavor of for understanding how risks are combining and compounding. Why does this matter in any way to social protection? Well, there's a number of reasons. And in fact, the importance is probably best highlighted twofold. One is that compound risk, and as we've seen from COVID, can really affect the need for social protection systems and mechanisms to be mobilized. We've really seen that through the kind of the COVID pandemic. There's been a 10-fold increase in the amount of mechanisms since March this year, which is something that the bank tracks. But we also know that it can influence the delivery of existing social protection initiatives similar to the ones that Emma has mentioned. So it's twofold. It's both the need for new potential mechanisms and a diversity of those, as well as understanding how compound risk is likely to affect the need for existing ones to scale up and target new beneficiaries in different ways. Setting up a multi-dimensional system like this, especially one that might have an early warning component, really can help us understand, how we strengthen anticipatory actions and feed that into the wide spectrum of different social protection activities that are out there. More specifically, a better sense of kind of tracking of compound risk really helps us in being able to better target and prioritize different social protection activities, whether we know, if one risk is developing in a particular region that has a likelihood to compound with others, we can really target that area, or we can target the timing of the social protection system to be able to really have an impact prior to it really scaling up into a wider compound risk. Why we think these kind of analytics make sense and why we need to prioritize the kind of the real-time elements is really because, as you've seen in relation to some of those slides, you know, from the data we're collecting at the moment, we're seeing that historical compound risks don't necessarily always reflect in the same way for the kind of existing and forward-looking risks. So, you know, while many of the countries we see are ones we might guess, there are also many that wouldn't necessarily be on our radar. I wouldn't necessarily have assumed that Mozambique would be so high up in terms of warning of different compounding risks that are being developed. Other places, you know, like Botswana and Montenegro, at least in relation to the metrics that we have it right now, are also being flagged in large part due to things like the economic impacts, the reliance on tourism, and many others. So, you know, these kind of tools, they don't necessarily, again, we don't want to see them as a ranking exercise. They're really more a way of having a discussion, opening up a conversation around things that we really should be aware of as decision makers and to bring people around the table from different sectors. Last couple of things here. So how can we use this to think about better disaster risk financing, as well as how that feeds into social protection mechanisms? One is really to think about the greater need for triggers and disbursements to be thought of in relation to multidimensional contexts. So social protection will often be done on the basis of particular triggers. That's something that Emma just mentioned in the last presentation. Often these triggers are based on on relatively singular sectors. So whether that's things like rainfall for indexed insurance, whether that's vegetative cover from NDVI, what some of this kind of compound risk work and COVID more generally is forcing us to think about is the need for multidimensional triggers, ones that will factor in not just one particular aspect, but various different risks that might be compounding at the same time. Alongside that, it's not just multiple risks interacting, it's also the sequence of triggers. So in many cases, what we've seen is you can have medium-sized hazards, ones that wouldn't normally develop into a crisis or a disaster. But if we have two of them placed very close to each other, that can lead to a very big disaster. So again, when we're thinking about triggers and the need for expanding social protection mechanisms, it's not just in relation to a single hazard, but the need to think about multidimensional aspects as well as when they occur. That really can trigger issues of the need for the rollout of social protection mechanisms. And one of the last things here, like I mentioned, this really is kind of being pushed out as a tool for us to bring different stakeholders together. COVID has forced many social protection stakeholders and advocates to start thinking about things they'd never really had to think about, whether that's public health, pandemic response, the further impacts that things like COVID will have on the economy. So all of these things are interacted and we can't do them in relation to a single specific sector. So tools like these hopefully bring people together to start thinking about how and where the different points of expertise can be brought together. Last slide. So just to say, where do we go from here? How do we develop it? Like I mentioned, these kind of tools are really, prototypes for now. The bank isn't the only place where we're thinking about compound risk. We're also working with a number of different stakeholders and funders and donors, as well as development partners to start thinking better about how we track compound risk. We're hoping to build up a community of practice around this. But for the moment, it's very much focused at higher level analyses, things like country level analyses where we have better data. What we really want to start doing is thinking about inter-annual and intra-annual variations. So things like seasonality, which we know is so important for things like social protection. When do different hazards interact? Do they interact during the lean season or the growing season? And that's where we really need to be worried. That's something that Evie mentioned up in one of her slides. The other thing is to think about subnational resolution. So for now, like I said, much of our analytics is focused at the country level. That doesn't help country level decision makers or governments really think about prioritizing where to target their social protection or disaster risk financing mechanisms. So really honing down, in the future, we hope that we can look at the kind of subnational resolutions once we have data that allows us to do that. And then lastly, what we really hope this will become and really hope this is kind of morphing into is a system that draws in and thinks very much about how it can be tailored to specific applications. So, social protection has its own kind of mechanisms, stakeholders, it has its own processes through which it likes to operate. How can we think about feeding these in so that the right windows of opportunity can be leveraged when we do notice that there are countries or regions or particular subnational areas that we're worried about in relation to multiple compounding risk vulnerability. So this is the kind of the work that we're thinking about at the moment. We really hope that it speaks to many of the concerns that you have as a wider community within the social protection and disaster risk financing communities. And I hope that this kind of work can really galvanize a smaller working group and community of practice that starts thinking about how we embed better tracking of compound risk into development and humanitarian initiatives such as these. But that's it for me, and I think I'm passing on to Sophie.
Hi, thank you so much, Lindsay, and thank you everyone for your patience. I know there's a lot of information coming to you. So my name's Sophie Evans. I work at the Centre for Disaster Protection. I lead our country work there, and today going to be presenting some research that we've been putting together on tracking global ODA flows for COVID-19. I will be pretty brief, but before I get started, just encourage everybody to move around, walk around if you're able to, have a glass of water. I know certainly for us in Northern Europe, it's pretty unseasonably hot for us all. So please take a moment while we kick off here. So for those who aren't aware of the Centre's work, we are actually a small group of disaster risk financing specialists, economists and actuaries based in London with a global remit to support countries and the international system to manage risks. Fundamentally, we believe that disasters shouldn't be surprises. So over the past few months, we've been tracking the humanitarian development funding directed at helping low and middle income countries to manage COVID, both the health and the economic costs. And today's presentation is based on our most recent update in June, but this is a kind of ongoing research. So there'll be new releases up on our website where you can find this presentation in full. You'll be able to find the spreadsheet of all the original data, and as well as the methodology up there, as well as a few blogs that discuss the issues that we're presenting today. So why have we done this? There's three reasons fundamentally, as disaster junkies that we are, really is fundamentally we want to show what's working well and what isn't, and the gaps of the financial flows relative to need in the COVID response. Obviously, a global issue, an issue and disaster that's impacting us in unforeseen ways and untold ways. And fundamentally, the global nature of it is we thought a fascinating place to start. We also wanted to highlight where we need better reporting. So many of you, I know many of you social protection experts on the line, you'll know that data scarcity and working in data poor environments is just something that you regularly deal with. But for us, reliable financial tracking information and macro level flows is really supporting, we hope, the valuable information that we need to understand whether or not countries are making informed decisions in regards to their response to COVID. And the international system as well, I should say. And lastly, we wanted to assess what changes are needed to ensure that the international crisis financing system is working for the poorest countries. So a little bit, I'm just going to have to change 2 slide decks here, so bear with me. A little bit of what we have done. So I think everybody who has been following even a light touch news will have seen lots and lots of information and data about financial flows that are going to support countries, substantial financial packages being directed to support governments or communities. Many of you are involved in those decisions yourself. But what we were looking at, what we were concerned about, is that many of those numbers were just announcements, and we really wanted to understand what was committed, but also what's actually being dispersed in real time. So what we've tracked is new debt relief, new lending and debt relief from the IMF, the World Bank Group, and the regional banks. We've looked at humanitarian assistance provided through the UN and also G20 commitments to bilateral debt relief. And I noticed there was a question there earlier. We can pick that up in the Q&A. So what we haven't done and what we don't know as well, just to give you the limits of the research so far, is really how this money is flowing through countries. So many of you working in social protection will know that getting the money into the country is only one part of the story. So for us, effective disaster risk financing is not just how the money reaches the country's balance sheet, but it's actually about how that money flows out from the government to support those poor and vulnerable communities impacted by those shocks in this context, COVID. And for us, this is part of what we're considering next. And I'm really delighted and very grateful for the invitation to present today, because actually, I think many of your all of you on the line, your own experience and impacts will be very relevant for answering that question. So I hope you'll bear with me in presenting this, but looking forward to the following up of the conversation as well. So fundamentally what we found, our latest analysis and this release highlights that we've got 39 billion committed by the IMF, the World Bank, the regional banks and the UN, with another 10 billion in G20 debt relief. Most of the funds that are committed are loans. About 23% of those are concessional from the World Bank and the IMF. And I should say that the single biggest commitment outside of the multilateral system is the suspension of debt payments on a bilateral agreement. But what I also should flag is there's not a huge amount of transparency that we were able to find on that figure or how that money's flowing. So just very quickly to run through the figures, and I believe the slides are being shared afterwards, so you know, I'll just do a light touch. So briefly breaking it down, you can see the commitment there by the Bretton Woods institutions, and you can see also then the impact of the debt relief as well. The next slide, oh sorry, I'm realizing I'm not changing these for you. So there's just the breakdown. You can see there on the left hand side of your screen, it's broken down by humanitarian appeal, World Bank, IMF, regional banks, and then on the right hand side excluding the bilateral debt relief. And that's in millions of dollars. And then the next one is just highlighting that most of the Bretton Woods financial flows to support COVID are in fact loans, and the IMF commitments are about twice that of the World Bank. Comparatively, you can see there that my next slide will be a breakdown by country. So you can see a lot there has gone to sub-Saharan Africa of the Bretton Woods assistance, when actually the UN flows have gone to 35 countries out of the 54 targeted by the Global Humanitarian Response Plan run by the UN. The other thing I should flag as well on that slide actually as well, that count includes all the CAT DDO payments. So some of the instruments that were mentioned earlier and some of the discussions and presentations, you'll see that those have been included and those instruments have paid out. One other thing to note from our research, which the data, if you download the spreadsheet, will play out as well, is that the ADB is leading from a regional bank perspective with its highest lending going to the Philippines, Indonesia and India. So just a few country breakdowns there. So really, what are we learning from this? So yeah, it's good to know where it's going to, what does it mean, and where are we heading with this? So as I said, it's not enough just for announcements. We actually need disbursement and we need quick money. I mean, disaster risk financing, as every presentation has already showed you, that speed is of the essence. So the good news from our side, from our analysis, is that funding has both been significant and timely, and the speed on the committed funds is largely mirrored on the disbursement side. So what's fantastic is these aren't just empty promises. For us, as I said, disbursement means reaching the government's balance sheet, and whilst our research wasn't able to look beyond this, I think some of the interesting things that are happening right now are the debt payment suspension. So as I mentioned, there's a kind of loan repayment holidays. We can see that these are providing additional fiscal space to governments, allowing them to spend on other emergent needs like health system strengthening or indeed transferring it to households. Many of you might have experienced that in the countries where you work. There are also new IMF loans that are being dispersed, and those they're a one-time payment within 6 months of signing. So that's pretty quick money coming from the IMF. And also over the half of the World Bank loans that have been dispersed since dispersing in April all across sub-Saharan Africa and South Asia, as I mentioned. So there's less consistency in the disbursement when looking at the UN GHRP money. So it's either money on its way or it's arrived. But some of the reporting on that isn't as consistent, so we haven't been able to analyze it in depth. That's not to say it's not happening, it's just to say it's slightly difficult to get the speed out of those disclosures. So the next slide. So in terms of that quick mobilization, and you can see there the CAT DDO instruments, you can see the loan instruments from both from the IMF and the World Bank and the IFC. We have been pretty impressed, and that slide really, sorry, is just showing you some of the timelines. I'll go to the next one, and then this is just a bit more information on the UN commitments over time. I should say, so we're making several snapshots here. So we've got the 1st of May, we've got the 20th of May, and we did some additional analysis as of June. We're running those reports, I think, pretty much every other week, if not every month, as the monthly reporting are coming out of all of these institutions. And whilst that is, as I said, it's good to get the information. What does this really mean, and what are we getting to the heart of? Is it money moving around the system? We had lots of questions about how this was flowing when we were looking at the analysis. I think our primary question was, does this actually represent new money, or is it just money being moved around by the international system in a way that it's very difficult to get to the heart of it? So the good news is that there's indications that there's actually is, some of it is new money, not all of it, but a lot of the emergency loans from the IMF are clearly new money, and the World Bank, whilst the World Bank is lending from its existing capital. So a key question for us was whether are we just repurposing things and therefore getting a misrepresentation of the actual support going to countries. One of the key indications we got is that the COVID-19 funds that are being lent to the world's 76 poorest countries, so those are countries that are borrowing on the concessional terms from their IDA allocation, is being financed through current unused resources. So that's money that is available to borrow, whereas countries that are borrowing on less concessional terms from the IBRD, part of the World Bank, are able to access additional unused IBRD capacity for lending. So there's a bit of a distinction there. And fundamentally, my last slide, and it's a few, I will rattle through this because I'm keen for questions and aware of the time, is fundamental point out of that learning. So whilst yes, it's good and timely, while yeah, we're seeing disbursement and commitment, and yes, it's indication there is more money out there and new money out there, what our finding is actually showing is that the funding is disproportionately going to better off countries. So what we mean there is that the funds fundamentally are flowing towards economic losses because of COVID, rather than those where poverty will increase most as a result of the crisis. So this may be a reflection a little bit on the fact that the crisis so far is hurting richer countries more immediately, or actually it's richer countries that have larger caseloads and larger predicted growth impacts. And many of you who are working in data poor environments will know a lot of the complications of doing this from a top-down perspective, and some of the gaps in really getting to the heart of that inconsistency or that conclusion that we found. But also we're looking, some of our analysis is also showing that the funds that received so far per capita are higher for countries that are ranked as having a higher pandemic risk with a bigger expected shock to GDP growth. But the countries with the highest expected poverty impacts are receiving less per capita, showing that the funds have been directed towards economic losses rather than places where poverty will increase because of the crisis. And those estimates are based on World Bank poverty rates, etc., etc. So really, just to conclude here, what we found from our research is that because of the international system is relying fundamentally on the equivalent of low interest credit cards to help countries manage these crises, our assessment is showing that poorer countries have access to less cash to manage this crisis, so grants or other types of free money, and more cash has been made available in places that have larger economic losses, but not the places where poverty will increase. So this pattern continues. The global response that we're looking at now, we're all part of that system, whilst it might manage the economic fallout very well, it will not put people back on a secure path out of poverty. And our findings are also highlighting the need for reform and how the world is paying for these crises in the first place. So the low interest credit cards are important, but they aren't enough. And we also need good insurance, and some of the instruments that are outlined today that align very well to the social protection mechanisms we've also seen today are really fundamental to understanding how to do this better for countries. So I'll stop there, and I think I'm handing back over to you, Evie. But as I say, just all of this information is on our website. I believe they're sharing the slides, and I apologise for rattling through that. But the snapshot really and the key takeaway is really that last slide. Thanks.
Thanks so much, Sophie, and thanks to Emma, Lindsay, Olivier, Simon, and everyone that's joined us today. So just going to do a very quick passing summary, and then we're going to move to questions. I think we should be able to get through most of them, and if not, we'll share answers. And as Sophie said, we've been rattling through, so yeah, apologies for that, but there's lots to talk about. And if you visit the financialprotectionforum.org, that's our kind of web space where we have lots of materials and information, so please do go there. Let me see if I have control of the slides. I'm not sure. Yes. So just to summarize, so we've been talking about disaster risk financing, pre-positioning finance ahead of a shock, and the benefits of that in terms of reducing the welfare losses and the need for vulnerable people to adopt negative coping strategies. But also, COVID, we've been able to see the benefits of a DRF approach and the benefits of shock responsive social protection, but it's also highlighted some of the still things that we don't know and some of the weaknesses. But really, it's shown that those that are better prepared are better faced to kind of respond. And this doesn't necessarily just apply to social protection; it can also apply to other critical sectors, whether it's health, nutrition, education. How can we learn from the social protection system and those shock responsive mechanisms to better it? And from our side, from the crisis and disaster risk finance team, a number of us have worked in the private sector, and we're trying to build some of the bring to this area some of the lessons we've learned on kind of the principles around market-based instruments and what that does in terms of transparency and objectivity in some of the way that we finance these issues. It's not a silver bullet, but it can support some of those quick financial needs. Yeah, I won't run through that. We're going to kick off with the questions because of time. And I think the first question I'm going to pose to Emma, and then I think maybe question 1, 3, and I think it was 4 or 5 was for you, Emma. So maybe if you want to start, and I can also jump in as well, if that's okay.
Sure. Thank you very much. I think the first question was around the internal coordination, question 4. And here, yes, that's a very good question, and I can give some examples of how this has been done. The first one, briefly, is in Kenya, where we did work very closely with the DRFI team for the preparation of the disaster risk finance strategy. And we also worked closely together on a CAT-DDO operation where the disaster risk finance strategy was a prior action. And similarly, when we worked with the government to design the social protection program that is financed by the World Bank and DFID, we involved the disaster risk finance team very closely in those discussions with the government as well. With the Ministry of Finance when we discussed the financing plan for the Hunger Safety Net program. Another example is the ongoing discussions in Senegal, where we are also engaging with the macro team and the disaster risk finance team and social protection. There are discussions on DPO, budget support operation, where we are jointly discussing with the government on potential triggers in that operation. There is also a potential CAT-DDO operation, a catastrophic drawdown. I'm using World Bank terms here, but it's an instrument that can disperse when a catastrophe is declared. And that is also, there's some ongoing discussions around that in Senegal as well, jointly with these teams internally in the bank, with the government, which includes the technical sector ministries and Ministry of Finance. There was another question around the Hunger Safety Net program, if it's currently financed by the government and how it's targeted. So the answer to the first question on the fully financed, the Hunger Safety Net program is currently fully financed by the government. By that I mean that the government finances all the regular cash transfer programs, and it also finances the shock responsive cash transfers. But as I mentioned earlier, there is a program set up around disbursement-linked indicators, where the World Bank and DFID disperses money upon achievement of results. And one of the first results under that operation was that the government would take over financing of the regular cash transfers, which they achieved, and financing was dispersed. And then there is an ongoing disbursement-linked indicator that every year that the government manages to finance the emergency cash transfers, the World Bank and DFID both disperse financing upon achievement of that result. On the targeting, the Hunger Safety Net program uses a proxy means testing approach. So the households that are registered in the mini social registry are ranked according to the PMT formula, and it's combined with the community validation. There was another question related to Somalia, if there is an active social protection program in Somalia. I don't personally work on Somalia, but I know that there is an existing cash transfer program that was approved in August last year and is active. And then there is one for emergency locust response, but it was just approved end of June, so it's not yet effective. I think those was there any other question for me?
I think you've got them all, Emma. If not, we'll pick them up afterwards. But
Okay.
let me jump to spread the questions around. So Lindsay, question. Thanks so much, Emma. Question 5 for Moses. Would that be okay?
Yeah. Yeah, I hope you can hear me. So there was a quick question around whether this particular tracking exercise at the moment is being used for disaster risk financing and internal mechanisms. So I can give an idea as to the kind of the objectives that we have for it. Maybe Evie as well has some more insights on the kind of the country level applications. But from our side, very much we are aiming for this kind of approach to have regional and country level applications. The important thing to say is at the moment it hasn't, because it's very much a prototype. So we're very conscious that it's not a good thing to be disseminating information at the moment that we're not yet fully certain of that is robust. So we're really hoping at in the next few months and weeks that we improve the methodology, we incorporate as much information and indicators that we can, and that when we feel it's ready to be good enough for decision making, that it gets applied to the relevant people. And when I say relevant people here, again, for the type of application that we're developing at the moment, because it's country level based rather than sub-national, we're probably looking more at kind of the regional level decision makers and people who have a kind of a portfolio level approach, rather than country level applications for now. That the hope is really to expand this to analytics that give insights at sub-national levels. I would really say as well that how we do that is very important. So it's not just having a tracking system that will lead to important kind of uptake measures. It really requires a thorough and dedicated thought process about how you integrate that kind of risk information into effective decision making. So whether that's horizon scanning exercises, whether that's bringing people together to think very carefully about how you communicate each of those risk information, make it transparent, make it understandable, and hopefully interactive. Each of those things are very, very important when you think about the use and translation of risk information into eventually disaster risk financing and social protection mechanisms as well. One other thing I would really say is that this type of initiative isn't unique. Things like FuseNet is in a sense a mini compound risk tracker. They do track issues to do not just with food security, the things that relate to food security, such as conflict, fragility, institutions. All of those things are factored into some of their metrics. What we really see some of these kind of larger compound risk tracking efforts as doing is to not just look at it from a kind of a relatively siloed sector level approach, but to try and bring different sectors together to have more of this comprehensive overview. So that's the idea. We hope that in the near future, in the next few months, that some of those applications can be thought about. But like I said, the important thing is not to finish the analytics and assume that it's all done, but to very carefully think about how you communicate that and look at the uptake mechanisms, because they're just as important as designing a robust tracking system. Evie, I think that's it from my side, unless there's other questions you'd like me to tackle.
No, that's great. Thanks so much, Lindsay. And I think we've been given a couple more minutes so we can make sure we can get through all these questions, which is fantastic. So just looking at question, sorry, I've lost my order, question 7, I think it is. So is there a methodology for tracking, monitoring national budgets, especially in developing countries, and allocation to disaster risk financing or social protection? Is there anybody, I don't know whether Sophie or anyone would like to take that one? I can also give a few comments. So Sophie, I'll pass to you.
Yeah, I would say, so from my perspective, there isn't a standard methodology. A lot of this comes from a country's willingness to have their public financial records interrogated. So a lot of this relates to public financial management work and looking at kind of expenditure tracking surveys. Is where we get a good source of financial losses that aren't readily disclosed, especially in developing countries or poor and low income countries. One piece of work that we're actually doing, where it's a longer piece of research, is really working to analyse how COVID has impacted the national budget. So we're working with a couple of countries with some teams embedded in the Ministry of Finance and local financial authorities to understand what public funds are being diverted towards COVID. So hypothetically, what's not being spent on the education budget, instead to prioritise the healthcare budget, to try and give an indication of the sorts of real-time decision making that countries are doing to be able to create the right fiscal space for themselves to deliver their own COVID response. I think we have a really good outline on the humanitarian flows. We've just done a piece of work with the most recent GHA report with development initiatives, and they have a really good kind of macro picture of how funds are flowing, and a pretty decent analysis as well of some of the private sector flows where they're relevant for disaster risk financing. So I would take out, I think that was just released a couple of weeks ago, so I would take a look at that report as well. But otherwise, keep track of, we'll be sharing, I think, some of that information later on next year, but Evie, you might have more to add in the more concerted way the bank does it.
Yeah, thanks, Sophie. So at the bank, there's a number of kind of public expenditure reviews done in conjunction between the government and our colleagues in the macro team. And until fairly recently, those reviews didn't necessarily focus on the funding allocated for disaster response. However, we've been working more closely with our macro colleagues to actually start developing disaster-related reviews. So, and we're doing this in a couple of countries, and hopefully going to be developing some more standard methodology as to how you would do that, because it's there's a balance between some of the instruments available and actually tracking expenditures for those instruments, and it's not always clear where money is set aside in particular for specific disasters. But a number of countries are exploring doing that and being able to see, where could we be more efficient, and how can we are they actually aware of the amount of funding that they have to reallocate? Because that feeds into the narrative and the importance of risk analytics and understanding the funding you need, because it's not always that easy, we find, to get data on what's spent and actually what's needed. On question 3, there was a question around how fast data can be updated in times of a disaster to expand coverage. Really good question. And it's something that, so I work closely with the social protection team in Malawi. I'm kind of leading the DRF component there, where the government are looking to scale up their social cash transfer program. And in the wake of COVID, they wanted to use that cash transfer program to release funds to new beneficiaries and quite quickly. So predominantly that safety net covers those in rural areas, not the kind of 2 or 3 big cities in the country, but actually they found that they were the people that were going to be most affected by the economic crisis. And they've actually been able to because they were working on a shock responsive social protection program already, and they were already having those conversations and investing in the systems, they were able to respond fairly quickly and register a number of beneficiaries, and now they're already making payouts to those beneficiaries. Had they not have been in that position, then, had they been at a more kind of latent or nascent stage, they would have found that much more time consuming. So it's all about, the gold standard is to have a very quick way to register people. And in some countries, those systems exist, more developing countries in some cases, but even where that conversation has been had and they have shock responsive systems, they can then leverage on that and things can happen much more quickly. And then finally, there was a question, I think it's the final one, but apologies, I may have missed one. There was a question, I think it was question 2. Let me just scroll back to it. So question for Olivier, but I'll kind of jump in if that's okay, because he's had to drop off. So many African countries are calling for debt forgiveness to support their national efforts for COVID-19 recovery. What role can the World Bank, linking with IMF, play in supporting this to make financing available for DRF mechanisms and toward a progressively universal DRF mechanism in Africa? And I think Sophie touched on some of the actions that were made after the COVID crisis hit, but the World Bank president stressed that in July that the need to extend the time frame for the debt service suspension initiative and to conduct consultations about this debt overhang and to improve the debt resolution process. So the intention of this is to allow vulnerable countries, and especially those in Africa, where debt stress was already a real issue, to be more financially resilient towards disasters and crises, including their response to COVID, but with that kind of compound risk issue in mind. And in addition, the further development of pre-arranged financing instruments, including market-based instruments, could help countries improve the timeliness, speed, and efficiency of their response post-disaster. And the president stressed that this is even more important. This agenda is even more important with COVID-19 having kind of changed the goalposts and pushing back some of the advances that have been made recently. Just checking there's no more questions. Simon, please butt in if I've missed anything, or anyone else.
I think there was one from Sumit, but I've actually just the first question, but about any evidence or any evaluations on timeliness of some of the responses for funds to get to reach people. So governments dispersing funds to beneficiaries, but I think a lot of that can be covered in the HSMP and PSMP and other shock responsive social protection evaluations, which have got a really good description and detailed analysis of that timeliness there.
Yeah, exactly. And I think Emma mentioned this a little bit, but one of the real benefits of a DRF approach is that the transparency it brings, and then but you still need to be able to monitor where the funds get and who it goes and how long it takes. But I guess yeah, and that would come through some of these evaluations. But through a World Bank project, there will be requirements to to meet certain, whether it's in HSMP reaching people within 1 month or 2 months of a trigger. There will be requirements, and therefore they have to be met for certain kind of project milestones to also be achieved, as Emma was talking about. Okay, I think I'll stop there. Bang on time, I think. If there's any other questions, feel free to to send them into the organisers, and we'll try and cover them in our summary. But thanks so much to all the speakers, and yeah, great to have you all on the line and learn from everyone. And thanks so much to everyone who asked questions and joined us today.
Thank you, everyone. Bye.
Thank you.
Thank you very much. Bye-bye.